My name is Ramnarine Boodoo, and I am a child and adolescent psychiatrist at the Penn State College of Medicine. My patient population is primarily middle class. We do have a good spread of diversity, mostly white Caucasian folks, but definitely a significant African American, Hispanic, and actually Nepali population as well. And I have a special interest in childhood trauma. The pandemic really took a toll on the mental health of youth across the country, if not across the world. And we had recognized the need for this in the community, particularly in schools. And so when the opportunity came along, again presented to me by a senior colleague, I thought that it was something that would be very worthwhile. And definitely an experience for not just enhancing psychiatric care in the community and in schools, but also an opportunity for my own personal growth and development. The pandemic took a toll on youth mental health across the globe, and I think schools were hit especially hard. Nobody was prepared for online learning when the pandemic hit. Online learning is not for everybody. A lot of kids really struggled, and not just academically. School provides more than just didactic learning. Kids get a chance to participate in social activities, connect with peers, develop social skills, learn how to manage situations, learn how to interact with people who are senior to them. These things were lost during the pandemic for many, many people. And coming out of the pandemic, there was again a bit of an adjustment, not just for students, but for staff as well. Parents seem to be perhaps a little bit less understanding, a little bit shorter, having a little bit of a shorter fuse. And so all these factors played into it being a less than ideal situation post-pandemic. It sounds like perhaps things are starting to even out now. Participating in this series really allowed me to connect with and empathize with school professionals. And this series really gave me an opportunity to do that, to see things from their perspective. And it gave me a chance to understand their struggles. Having the echo sessions wasn't just about conveying clinical information. It became, for them, and I have to admit for me, it became sort of a therapy session. We would talk about issues, situations, and we would share perspectives, and I think that was very therapeutic for everybody. Though you could actually see the learning community starting to emerge.